Got it? So we get them off the X, check that tourniquet, make sure it's good. Check those major sites for bleeds, armpits, groin, back of the neck. All right? If you find anything, wound pack. Now we move into A. What's A?
Airway.
Right. So what's the first thing we do for airway?
Check if he's breathing.
Check if he's breathing, right? How do we do that?
Look, listen, feel.
Look, listen, and feel, right? Both hands on the chest, looking down. Feel and see if he has any breaths, right? If he's not breathing, what do we do?
Jaw thrust.
Jaw thrust. What are we looking for?
Anything in his airway.
Right? Exactly. There's an acronym on here. LOBS. I'm fine with obstructions. Any obstructions. There's an acronym on here. It's LOBS. Lacerations, obstruction, broken teeth, bruising, swelling. Right? So we open it up. We look. We look, listen, and feel again. Right? Still not breathing. We'll reposition him. Look, listen, and feel again. Right? Still not breathing. Then what do we do?
The NPA.
NPA, right? So we get the NPA, what's the first thing we do?
Measure it up.
Measure it
Measure
the right
from
size.
ear to nose.
Ear to nose, right? Somebody give me NPA.
I forget to measure mine every time.
Yeah, it's cool. There's all the mannequins, but make sure you measure it. You guys already know how to do this. We made sure you guys know how to do all these skills, right? That's why we did that first. Alright, so we're going to measure that NPA, right? Narrow to earlobe. Make sure we get the right size. Lube it up. What can we use for lube?
Spit or the gel on the package.
Or the gel, right? Which way should that bevel be facing?
Towards
Septum,
the septum.
right? Alright, put it in. NPA is in. What do we do now?
Check pulse.
Make sure it works. How do we do that?
Look, listen, feel.
Look, listen, and feel. Again, right? So he's breathing. What do we look, listen, and feel for this time?
The rise and fall of the chest.
Rise and fall of the chest. If one side's rising, the other side's not, what is that indication of?
Needle D.
Collapsed lung, right? Collapsed lung. So how do we treat that?
Needle D.
Needle D, what do we got to do first?
You want to look for any post
Any puncture wounds.
Alright, so we tiger claw, right? Fingers, want to make sure we get every single spot that we can, right? All the way through. All the way
All
through.
those like little things. Are we gonna be treating us?
No, you will later. Yeah, later. You'll see. They're just burns. Right? All the way through. Oh, we don't see anything on the front? Oh, fuck this mannequin. God dang. So we can roll him over. Same thing on his back, right? Make sure we get every side. Find everything. We don't find anything on his back, but since we have him rolled over, right, we check his C-spine. Look for any step off or deviation. Then we piano key his spine. Go all the way down. Make sure we don't feel anything crazy. Right? All the way down. You want to check for internal bleeding, so you credit card swipe his ass. Right? Do that. All right. Nothing. If you do find something, you just note it. Roll him back over. I just move my patients. What do I got to do?
Recess everything.
Recess,
Tourniquets.
all the tourniquets, everything, right? If there were any entry ones, what would I do?
You'd patch them up first.
Absolutely, right? Chest seal. What if we don't have any chest seals?
Use debris or anything plastic.
solid plastic
Right.
tape.
Or use one of the packaging for the
Right. How many sides do we tape down?
all four.
All four, right? All right. I wonder if there's any. No, there isn't. All right, cool. So we tape up all the sides. What do we do now?
Then we need to use
What are my landmarks?
the center of the collarbone down.
Center of the chest.
Right? So look at your jugular notch to your shoulder, mid-clavicular line, so mid-collarbone, right? Down to the second intercostal space, which is in between the second and third rib. It's right here. These ones actually have ribs. How do we put that needle in?
Straight down.
Straight down.
90-degree angle.
Which way should that bevel be facing?
The boots.
Towards the boots. How long is that needle?
14 gauge by 3 1/4 inches.
3 1/4 inch, right? I go in. How do I know it worked?
So you'll hear it, or you'll see it or feel it.
See the chest.
Yep, absolutely. Okay. Alright, cool. So it's in. We did that. What do we move on to now? We're done with respirations.
Circulation.
Now circulation.
Circulation, right? So we got to do our secondary
his
blood
pulse.
sweeps. Check his pulses, bilateral radial pulses, all that, right? So we do, it's called DCAP BTLS. They kind of touched on it this morning. You don't have to know the full acronym, as long as you know you're looking for shit that's not normal, right? So DCAP BTLS stands for deformities, contusions, abrasions, punctures, burns, lacerations, tenderness, swelling. Right? So we do that. Oh, here's that one on this side. We come through. We get rough with these guys, right? Want to make sure. We look for crepitus. We look for, you guys know what crepitus is? It's
The
like
cracking of the bones.
Yeah, cracking of the bones, exactly. When bones are, the broken bones are grinding together, right? Just grab, Indian burn, you know, rub everything, go all the way down. Look for those, any other wounds that we're finding. Right? Come up here, check his collarbone. Sorry, I know you guys can't see behind me. Look for any crazy shit on his collarbone. Check his sternum, so we do the pray hands. Right? Make sure his sternum isn't broken. Check his ribs. Close the book on his pelvis. These fucking manicures are yes. So we're checking to make sure he doesn't have a broken pelvis, right? Close it. If it moves, you guys will feel it. It's fucking weird. If he has a broken pelvis, you just note it, right? Check his abdomen. Right? You guys know what we're looking for here?
Any bones that like chipped off and down.
bleeding.
Internal bleeding is called TERDs. Tenderness, rigidity, distension, and swelling. Right? Looking for TERDs. That's what we do. If I'm moving too fast, please feel free to stop me. Like, I'm just kind of cruising through this real quick. I'm going down the list. Circulation. And the big thing that people always forget in circulation is to check those bilateral radial pulses. He obviously doesn't have one on this. So just make sure you verbalize to check his pulse and actually check that pulse. Alright? Any questions before we move on? No? Anything? Alright, what comes after
Head or hypothermia?
head or hypothermia, right? What are we checking for?
Halo.
Yeah, we'll do the halo test. First, we want to look for decap BTLS in his head. So anything that's not right in his head, right? So we don't ever use the tips of our fingers when we're checking their head. Because if they do have a crack in their skull or something, we don't want to shove our finger in their brain, right? So use the palms of your hands. Just go all around their head. Look for any fractures, make sure nothing's moving or anything, right? At this point, we'll check his pupils. You guys know what we're looking for in his pupils?
Blood.
Dilation.
Dilation.
Dilation, right? It's called perla. Pupils equal round reactive to light. So you check both pupils, make sure they're equal. If they're not, you guys know what that means?
It means head trauma, TBI.
TBI, right? So we'll check, we'll shine a light in there. You guys don't have a pen light. And then we'll do the halo test. Check for a CSF, cerebral spinal fluid, anything like that. So you'll take a piece of gauze, pull it up to his ear, set it off to the side. The spinal fluid and the blood will separate, create a little halo. I think that's on there too. Check his nose, make sure nothing's his nose. You'll check for battle signs. You'll check for raccoon eyes. Check his teeth. Again, always check his airway. Anything else? Alright, so head hypothermia. What do we do for hypothermia?
Take off anything that might be wet on him.
Anything that might be wet. We have, well, you might have the hypothermia blankets. They're huge, so probably not. Anything, keep them warm. Throw it on them. That's all you gotta do. We'll give you the blankets, you just lay it over them. It's after head hypothermia.
Pain management.
Pain management, what do we give them?
It's medication, but first you need to give them the antibiotics.
Well, you'll give them antibiotics afterwards.
Mobic and Tylenol.
Mobic and Tylenol, what are the dosages?
650.
How often?
Tylenol
Every 8 hours or
once a day.
once a day. Alright, so we move on. We did pain management. We go on to antibiotics. What do we give them?
Moxifloxacin.
Why do we give them antibiotics?
So that way it doesn't
So
get
that
infected.
he doesn't die from infection.
He has open wounds, right? Any open wounds, antibiotics. Give them to him. Give him 400 milligrams moxifloxacin. Move on. Antibiotics is done. We go on to wound care. So that's when you'll treat like these minor wounds. Any minor wounds you saw while you're doing your head to toe, your secondary assessment, you'll treat. Minor things. Alright, so when you're doing that secondary assessment, like I said, just kind of note them. Like, hey, he's got a fuck ton of burns on his chest, he's got cuts on his arm, whatever. Just note it and then come back to it during this wound care phase. And then while you're sitting on your patient waiting for that bird to come, then you'll treat those. Alright? And then splinting. Obviously, he doesn't have any broken bones because he has no fucking bones. But some of the mannequins you use tomorrow will have like broken legs, and you guys will splint one or whatever. What do we do after we're done with the whole assessment?
9 line, call it in.
Z-miss and 9 line, right? So you guys know what Z-miss is?
Yes.
What is it?
ZMIS is your ZAP number,
ZAP number?
then the mechanism of injury,
You
injury
got-
sustained,
Yep.
symptoms and
Okay.
signs, and trauma or treatment rendered.
Right. Okay, so you'll do a ZMIS report, just make one up. Obviously, make up the ZAP number, but you guys will say what wounds he had or whatever. And then 9-line. You guys can write down your 9-line and have that card on you for your test tomorrow. So you don't have to sit there and remember it. Yeah. If you have it memorized, good for you. You're a superstar. But the rest of us, we just write it down. You can have a little cheat sheet for that. Yeah. Any questions? You guys are going to be practicing this all afternoon, and all of us instructors will be walking around. So if you guys have questions, I know I kind of went through it really quick, but you guys will get time to practice on these and see them. Yeah, you either do it with partners or on the mannequins or whatever. You guys will have your cheat sheets today just to look at.